Okay, so this is my interprofessional video project about perfusion. So, what is perfusion? According to perfusion education, perfusion is the passage of blood flow through the circulatory system or lymphatic system to an organ or tissue, usually referring to the delivery of blood to a capillary bed in a tissue. All tissues need perfusion. They need adequate blood in order to survive. Poor perfusion leads to ischemia, which could manifest as cardiovascular disease, coronary artery disease, cerebral vascular disease, such as stroke, peripheral artery disease, and more. And we have different members of the interprofessional team to work together to fix any issues with perfusion. So the first member is a paramedic. The EMT course, or they need a high school diploma or GED, and have to have taken an EMT course and also then a paramedic program. The EMT course must be state approved and may take less than or up to 6 months. The paramedic program must be CAA-HEP accredited and can take up to a year. And it usually requires about 1,200 to 1,800 hours. It's required that paramedics maintain an active license, just like any other medical professional. Most paramedics will work with an ambulance service or in a hospital setting, but they can also work in a fire station and ride along with firefighters or in different camps and programs. They are the first responders. So if there's a perfusion problem, their job is to get them the proper immediate care and then transport the patient to the hospital for more extensive care afterwards. And that is why they are an important member of the team. Some examples of the care that a paramedic could perform on the site in regard to perfusion could include CPR, applying a tourniquet, treating a severe wound. They can also start an IV line or intubate if necessary. So their role in perfusion, they deal with all of the organs because they can walk into any situation. There could be an injury to any one of the organs. They are also acutely caring for patients no matter what is going on. They are completing immediate life-saving measures, potentially, and sustaining perfusion in order to help a patient make it to the hospital. Any longer-term care for perfusion most likely needs to be done in something like a hospital because there are more appropriate resources. But without paramedics, some patients may never even have or never will make it to a facility. In regards to tools that they use, ambulances can be stocked with things like blood pressure cuffs, IV equipment, defibrillators, gauze, ventilators, spinal trauma boards, gloves, medications, fluids, and of course, hospitals have even more equipment if that's where a paramedic is working. And their main role and why they are important is that crucial transport. So the next member are respiratory therapists. You need at least an associate's degree. That's the minimum requirement. You can get that in respiratory care or a bachelor's of health science in respiratory care. RTs also need to pass a credentialing exam and maintain a license just like a registered nurse would in their practicing state. RTs can practice in hospitals, cardiopulmonary diagnostic labs, rehab centers, nursing homes, home health agencies, and they're critical to the care team because airway is the most important thing to maintain. The A and ABCs and they care for anybody with any respiratory issues, acute in a situation like this, or even chronic. And for their role in perfusion, they work with the lungs. That's the organ that is of their concern. They use ventilators, suction, heated humidifiers, BiPAP, CPAP, high flow oxygen devices. And again, they're super important because of their intricate care of the airway. The next role is a perfusionist. They are a medical professional who is in charge of a heart-lung bypass machine. This requires a bachelor's degree, and then they need specialized training in order to learn how to run those machines. And then they have to get a certificate for that. Most perfusionists work in a hospital where there are life-saving surgeries being done. They are important because if a patient needs a heart-lung bypass machine in order to run their blood outside of their body for a particular surgery, they are in charge of doing so. So perfusionists and perfusion, their organs that they're taking care of are the heart and the lungs. And without a perfusionist, surgeons would have to perform extensive cardiac surgeries on a beating heart, which could make it more difficult. Some surgeries require the heart to be very still. The bypass machines basically serve as the heart during that time. Next member are CRNAs. In order to become one, you need a BSN. You need to be a licensed RN and get some experience in that role, and then you need to obtain a master's in nursing and then pass another national certification exam. This could take around 6 years or more of schooling. CRNAs typically work in hospitals, but they can also work in outpatient surgery centers. They can work in the military, they can work in different offices, such as for dentists, plastic surgeon, or pain management specialist. They are extremely important to the care team because they oversee maintaining sedation, administering medications, intubating, managing vents, and managing pain as well. They're there to make sure that the patient remains stable during a procedure. CRNA's role in perfusion, they take care of all the organs just like the paramedic. They are kind of maintaining perfusion in general. They have lots of different roles. They work with all of the organs because all of the organs need blood to perfuse. They use ventilators, ET tubes, medications, fluids, etc. to complete their job, which is crucial during a surgery because if perfusion is interrupted, the patient can have an injury to an organ or it can even become fatal, which again leads back to that stability of the patient. And then here are my references. Leave that up for just a second. But yeah, thank you for listening.